Each of us encounters situations or seasons in life that are stressful or difficult. It may be caused by financial struggles, family issues, medical illnesses, or many other unexpected challenges. Sometimes the stressors of life can seem to come at us from every angle. Being able to identify and manage diagnosable mental health issues in yourself or a loved one is important to maintain good mental health. But that's easier said than done. According to a survey by the Substance Abuse and Mental Health Services Administration, only about 46 to 65% of those with moderate to severe mental health impairment are in treatment. There is definitely room for improvement.
As a psychologist, one of my roles is to provide counseling. People come to me when there's something out of place in the story of their life. So it could be a hurt from their past that's still bothering them, or current problems in their relationships or at work. And sometimes these issues are related to a diagnosis of depression or an anxiety disorder. When people experience traumatic events such as abuse or a car accident or military tragedy, those events may bother them in the long term and lead to a diagnosis of post-traumatic stress disorder. Other times people struggle with alcohol or drug use. And in rare cases, people experience schizophrenia, which is when they may hear or see things that other people don't or have very unusual beliefs. The good news is that while there are a number of mental illnesses that affect adults and children, we do have effective treatments for all of those diagnoses. And the two main categories of treatments are counseling, like I said, and that includes talking to someone like me, learning new habits and skills to cope with stress, and also medication treatments.
Mental Health Council of the Big Bend commissioned 4 separate empirically derived surveys, and those were put together in a white paper by the Florida State University College of Medicine's Center for Behavioral Health Integration. We found some really interesting data. What we found was that the levels of anxiety in this region are higher than they are elsewhere in the country, that there's a lot of positive attitudes about mental health and mental health services, but there's a need for greater penetration in the community. So based on this empirical research, which really has never been done anywhere in the state of Florida before in this way by a grassroots organization, we evolved in concert with the community an action plan that we're currently pursuing so that we can make things better for the people of the region.
Everyone experiences periods of stress, sadness, grief, or conflict. So when you're feeling off, it can be hard to know when it's time to see a mental health professional. Hopefully, our experts have helped you understand what to look out for and when to seek help. This video has been put together by the Mental Health Council of the Big Bend, a group of local mental health service providers, experts, and stakeholders. To get connected to mental health resources or to learn more about them, call 211 Big Ben by dialing the 3-digit number 211 or visit 211bigben.org.